This is the upper arm nerve glide exercise. It's for those of you who are suffering from nerve kind of symptom going down the hand, around sort of the front of the palm, upper arm area. Okay, so it's common for those of you who does a lot of manual work with hands. Also, it can happen to office workers. Generally, numbness, tingling sensation going down the arm, or just a general tightness in the hands. If you had it for a long period of time, you had massages and treatment around this area, and it just doesn't really get better, this is an exercise that maybe you can try and give it a go. Just make sure that every time you do it, you feel just a little bit of tightness, a little bit of tension. You do not want it to push into too much pain, and this is how it goes. There are 3 versions. Number 1, if this is the symptomatic arm, this is what you want to do. You want to lift your arm into this position, so your armpit is about 90 degrees, okay? And you want to straighten your elbow, okay? Once you straighten your elbow in this position, so your palm is facing up, you want to see if you can feel that familiar symptom, that sort of discomfort, okay? If you don't, have a go at extending your wrist downwards like this, okay? Around this kind of position, if you do have issues in your nerve, in your median nerve, namely in your upper arm, then you should start feeling that familiar discomfort or that tingling sensation down the arm, okay? If that is the case, then we're in luck. We wanted to do this exercise, and this exercise should be effective. This is how it goes. You can bend your elbow, but while keeping your palm facing up, okay? As you bend your elbow, you should have that tingling sensation going away or reducing significantly. What you wanted to do is you wanted to bring your head away from that arm, okay? So you wanted to side bend away from that arm, and you're going to see if you can start feeling a little bit of discomfort, okay? If you can feel that a little bit of discomfort, that's great as well, but only a little bit. You don't want it to feel like an extreme aggravation down the arm, okay? So once you feel that, you want to stop in this position, and then you want to synchronize that head movement with the elbow, and this is how it goes. Okay, slow gliding through space, okay? So as you straighten your elbow, you want to bring your head back. As you bend your elbow, you want it to take your head away, okay? Every time you straighten your elbow, you want to make sure that you do not push too far in a way that it starts to really bring on the discomfort. A little bit of discomfort is fine. Sometimes, even if you don't feel much discomfort or any symptom, you can still do this glide, okay? This glides the nerve through all that soft tissue. Sometimes you can have a bit of scar tissue in the limb. It's good to glide the nerves through so you improve its function and its ability to send messages, okay? So we're going to do this, take it away, nice and smooth. And the word is slow. You want to do about 10 to 15 times of this, okay? And after you do it, you should feel a bit of a relief down the arm. This is version 1. Version 2 involves you to not move the neck, okay? Simply in this position again, have the palm facing up, armpit, shoulder in 90-degree position, okay? And you wanted to straighten the elbow, but in the same time, bring the wrist upwards so that you are bending your wrist up so that it looks like you're looking into a mirror. So you have that mirror facing the side of your face, okay? And you wanted to synchronize that movement, okay, of the elbow and the wrist, okay? If by any chance when you're doing this exercise you can start, I'm getting a bit of a sore shoulder, you can sit down somewhere and have your elbow supported on the table, okay? So then this is rested onto some sort of surface, and then you just focus on that elbow bending and that wrist bending, and they are synchronized and simultaneous movements. Okay, so you can focus on that steady movement. Again, you want to feel a slight discomfort or maybe no discomfort. You don't want to feel a lot of discomfort. Okay, have a go at doing 10 to 15 of those and see if the symptom sort of reduces, that tightness, that tingling numbness sort of reduces, or sometimes can even go away. If it does go away and if the symptom does reduce, then that means it's a good exercise for you.